I wanted to end this session on a scenario because this is part of Camp Neuro, and we're kind of a little more focused around neurology problems. An unfortunately common situation for neurology is a stroke patient. So a stroke is basically when there's been some sort of a clot or a blockage in blood supply to the brain. So part of the brain gets like the tissue dies, and there can be pretty severe consequences for the patient. And it can be, cognition, it can be motion, it can be speech, it can be sensation. There's so many things that are involved. And it's one of the situations that requires a really interprofessional, interconnected team. So I was wondering if you guys would all just give me a little summary of what your role would be in management of a stroke patient's care.
So I'm going to assume that this patient is presenting to me for the first time, kind of acutely, where like the stroke has just happened. So the initial step is to get a physical exam of them, like Anjali mentioned. A certain part of your brain is going to be not functioning properly. So you need to, have the patient move as much as they can. And localize the lesion, find exactly what the sick part of the brain is. And that can be through physical exam maneuvers, that can be through imaging, having them go through like a CT or an MRI, which are different ways of looking at like functional brain tissue, and then starting medical management. So, having medications that will help preserve that brain tissue or to reduce whatever damage. If they're a surgical patient, then intervene as quickly as possible to make sure that more brain tissue doesn't die. And then once they're out of that acute phase, then directing them to whoever they need to see to improve their functioning, their quality of life, and then finding adaptive measures if they do need to have anything happen.
So initially, we would go in to do an evaluation, and we would first see, are they oriented? We would ask several questions, see how they're talking. Depending on what side of the brain is affected will depend on what they can understand. Are they able to communicate? Are there words? Do they not make sense? So we would get a general feel for that through asking a bunch of orientation questions like, where are you? What year are we in? What's the name of the hospital? Then we would go in and administer an evaluation, a cognition, linguistic evaluation to see, are they good with memory? How's their short-term memory? How's their attention span? Several questions that evaluation involves. And then we would finish that session by administering a teaspoon of water. We would give them a little bit of pudding to see how they're swallowing, and if they're talking after they're swallowing, is their voice wet or gurgly? Are they coughing? Are they throat clearing? We would get a general sense of, do we need imaging? Do we need to see if there's something stuck somewhere throughout the swallowing mechanism? And we would also do a cranial nerve examination to see, do they have left-sided weakness? Do they have right-sided weakness? Is their tongue weak? Do they have good range of motion? Do they have a decreased sensation? We would get all of that in the first evaluation session. And then from there, we would plan, okay, they have reduced range of motion in their tongue. Let's go ahead and prescribe some exercises for that. Or let's go ahead and work some functional memory tasks to get their memory back and going. Let's work on some attention. It would all depend on their performance from the evaluation and caregiver reports, doctor reports, nursing reports, and we would go from there.
All right. And then as far as physical therapy goes, similar to a lot of these, we all have like an initial evaluation where you're meeting the patient and you're really getting a baseline of where they're at. And so that's like their status as well as their capacity. And what we're looking at for physical therapy is the ability to move. And so they might have trouble just in general with stroke. They might have weakness. They might have A part of their body may have gone into spasm, so that's where their muscle is completely contracted and they can't relax it. And so you're trying to get that baseline of what they can do currently, and then based off of their goals, which is in the acute care setting, we're trying to get people out of the hospital as quickly and safely as possible. And that could be going back home, that could be going to different types of facilities. And for physical therapy, we're sort of taking a look at also how they're progressing to when they can get out of the hospital, if they are safe to go back home or if they need to go somewhere else. So then we're using different ideas of like compensation, like if they are unable to get something back, you might compensate by teaching them how to use a walker or something like that, or a cane, or if it's recovery, and you're using both of these really. With recovery, you're trying to encourage them to regain the previous ability they had before the stroke. But that's what we would do. We try to get them out of the hospital as safely and quickly as possible.
So for occupational therapy, it's also, that initial evaluation, and also like what Kevin said with physical therapy, we just collaborate with them, especially with stroke patients. There's an overlap in some areas, but we look at the occupation based. We're very occupation based, which means like going back to, what do they like doing, what did they do before, and what is affected because of this stroke. Like, for example, if the patient had a stroke that occurred in the right side of the brain, then his left side of his body can be impacted. And if he's experiencing motor loss on his left side, and he's left-handed, then you can imagine how this is going to impact brushing his teeth, eating, dressing himself. And so now OT will help with the recovery by helping him learn new dressing methods. We can teach him, like, you don't need both your hands to dress. There's just different techniques. There's also adaptive equipment that can help with that. We can also just ask, like, what do they want to get back to do independently, like what is important to them. So we do, I guess, like our scope of practice is very based on like occupations, like what do they want to do because of like this injury, like they may have lost something, but we're going to try to help them get back to being as independent as possible.
So as a PA with a stroke patient, you can see these patients in multiple settings. You could see, oh, Kevin has to go. Everyone say bye to Kevin. You can see these patients in multiple settings. You could be an ER or ED PA, and this person could be coming in via ambulance, and you're having to first assess them, and they become your patient, and then you would get them onto a medical floor after that, and then you wouldn't see that patient again because you're only in the ER. You can be a part of a stroke team in a hospital. When that person's coming in, you're not necessarily in the ER, but you're then assessing that patient. You know everything there is to know about stroke patients. We can be on a medical floor, seeing this patient from start to finish, referring to OT, PT, SLP, talking with our supervising physician, making sure that the care is what it needs to be. Or you could be in a private practice as a neuro PA and seeing follow-up stroke patients and making sure that they're doing their OT, doing their PT, seeing their SLP. And then in the hospital, we work very closely with the nursing staff as well. And then with our supervising physician, just to make sure that the patient is progressing and getting the care that they need.
So the nursing role is going to be very dependent upon where we see you in this process. So if you come in with a stroke into the emergency room. One of the nurses is probably the first person you're going to see when you come in. We're going to be assessing you, rapidly bringing you back. You know, a stroke is a very critical event, time critical. So we're going to be prioritizing your care over somebody who comes in with, let's say, a infected hangnail. Bringing you in, assessing you, getting the rest of the team in there to see you as soon as possible. We are part of that assessment is, taking whatever medications the physician instructs us to give, making sure that we're giving those to you safely. It's really important that we know what kind of a stroke you had. There's ischemic strokes, which is a clot. There's also hemorrhagic strokes where you're bleeding. And if you give the wrong medicine for either one of those, you can make things a whole lot worse instead of better. And then once you are in the recovery period, once we have you moved up to an ICU or even a med floor, we're going to be making sure that you are staying safe and progressing in your care. And like I think Kevin mentioned, trying to get you home safely. So whatever education you've gotten from the other specialties, we're going to be reinforcing that education with you. We're going to be making sure you know what medicines to take and how to take them. We're going to be educating you about lifestyle changes. And we're also going to be trying to help you cope with emotional challenges that you're going to face. You may look different. You may have senses of loss. And as a nurse, dealing with all of that and helping our patients get through it, that's all within our scope of practice. So we very much look at it holistically. In addition to your actual physical care, we're trying to make sure that the whole patient is ready, provided for, and then gets home safely as they progress.
All right, well, thank you so much all for being here. I know this is one of the questions that I asked you about what your favorite thing about medical school or health school was. And I gotta say that I feel very lucky to go to a school where all these different professions work together. And I mean, just the opportunity to be on this panel with you all and learning from everyone. I mean, there's definitely stuff that I learned today that I didn't know earlier about some of these professions. So again, just thank you all so much. This was super educational. I know that my questions were pretty like baseline. Is there anything that you guys felt that you wanted to comment about your specific health profession that maybe we didn't get to? Yeah, sure, Emily.
Is there anything that you wanted to add from your perspective? Because you're also a medical student and you have wonderful things to say.
I mean, I guess kind of just to echo everyone is that like, no matter what healthcare profession that you choose, it is going to be difficult. I mean, that's kind of the life you signed up for when you picked it, but it's very gratifying in the long run. You're going to make a difference in so many people's lives. You're going to be there at their worst moments, and you're going to help them get to hopefully one of their best moments. So just remember that when things get tough, take care of yourself, stay hydrated, and make sure that you look around, because you're going to have amazing people around you, both faculty and peers, to support you when things are hard. Like our class, I know in my personal experience, has just been amazing in terms of just support, and like both academic and social and emotional support just has been a rock to rely on. So yeah, as students, whether you're in college, whether you're in professional school, whether you're in the workplace, just rely on the people around you.
I just want to add one thing. Being on this panel has been an amazing opportunity, just getting to learn from everyone. And one profession is not better than another. You just have to decide what you want and what you're passionate about, and kind of what you want to do for your life and your career, and go from there and just take it head on. And if it's medical school and you want to go through that, like, go for it. If it's, SLP or OT or PT or just, or like going to nursing school, whatever you want to do, I think you'll be happy with, and you just have to be passionate about it, and it'll be a good choice.
I also want to say it's okay if you don't know what you want to do. Like I said, I have a previous degree in English. It took me a long time to figure out what I want to be when I grow up. And it's not too late. I'm 37 and I'm in nursing school and I'm loving it. And I still have a long and valuable career ahead of me. So if you haven't 100% made up your mind today, that's okay too.